This lesson is important to anyone that administers medication or prescribes it. So this is for the LPN-RN and NP. You will be giving a patient lisinopril losartan, other ACE inhibitors, or ARBs. So you need to know why. So we will be talking about the Renin Angiotensin Aldosterone System and blood pressure regulation. Make sure you are taking some notes. The Renin Angiotensin Aldosterone System is a hormone cascade essential for blood pressure control, fluid balance, and tissue perfusion. Understanding this system strengthens comprehension of hypertension, heart failure, and kidney disease management. The process begins in the kidneys. When renal perfusion decreases, such as with low blood pressure, low sodium delivery, or sympathetic nervous system activation, specialized cells release renin. Renin converts angiotensinogen, produced by the liver, into angiotensin 1. Angiotensin-converting enzyme, primarily in the lungs, converts angiotensin 1 into angiotensin 2. Angiotensin 2 is a potent vasoconstrictor. It narrows blood vessels, increasing systemic vascular resistance and raising blood pressure. It also stimulates aldosterone release from the adrenal cortex. Aldosterone acts on the distal nephron to increase sodium and water reabsorption while promoting potassium excretion. The result is expanded blood volume and increased pressure. Angiotensin 2 also stimulates antidiuretic hormone release, increasing water reabsorption in the collecting ducts. Together, these mechanisms restore circulating volume. Science Pearl. Think renin raises pressure. If renin is released, the body is trying to increase perfusion. Science Pearl. Angiotensin 2 tightens vessels and tells the adrenal gland to retain salt. Tight vessels plus more volume equals higher pressure. Clinically, medications such as angiotensin-converting enzyme inhibitors and angiotensin receptor blockers interrupt this cascade, lowering blood pressure and protecting organs from remodeling. The quiz is next. How was the lesson? Did you get a good grasp? Or do you need to repeat the lesson again? A deep grasp of this pathway transforms pharmacology from memorization into logic. Strengthen your exam readiness with clear explanations. An AI tutor, practice questions, full practice exams, case-based learning, and more at NurseLearn Co. NurseLearn accepts Afterpay to support your educational goals. Okay, let's get into this quiz. Science checkpoint, Renin Angiotensin Aldosterone System. Question number 1. What is the primary trigger for renin release? A. Elevated serum potassium. B. Decreased renal perfusion. C. Increased blood, PRESS, URED, hyperglycemia. The correct answer is B. Here is your rationale. Reduced kidney perfusion signals the body to restore blood pressure and volume, initiating renin release. Question number 2. Angiotensin converting enzyme primarily converts which substance? A. Aldosterone to renin. B. Angiotensin to 2. Angiotensin 1. C. Angiotensin 1, 2. Angiotensin 2. D. Sodium to potassium. The correct answer is C. Your rationale for this question. Angiotensin converting enzyme converts angiotensin 1 into angiotensin 2, the active vaso. Question number 3. Aldosterone increases which of the following? A. Sodium excretion. B. Water excretion. C. Potassium retention. D. Sodium and water reabsorption. The correct answer is D. The rationale. Aldosterone promotes sodium and water reabsorption while increasing potassium excretion, expanding intravascular volume. Question number 4. Which effect is directly caused by angiotensin 2? A. Vasodilation. B. Decreased sympathetic tone. C. Vasoconstriction. D. Reduced aldosterone secretion. The correct answer is C. Your rationale. Angiotensin 2 is a strong vasoconstrictor, increasing systemic vascular resistance. Last question. Why do angiotensin-converting enzyme inhibitors lower blood pressure? A. They increase renin release. B. They block formation of angiotensin 2. C. They stimulate aldosterone. D. They increase potassium excretion. The correct answer is B. The rationale. By preventing conversion to these medications reduce vasoconstriction and aldosterone-mediated volume expansion. Next up will be a case study. I hope you did well on the quiz. This case study is about applied physiology, hypotension after dehydration. A 23-year-old patient presents with vomiting and diarrhea for 2 days. Blood pressure is 90/58. Heart rate is elevated. Laboratory results show mild elevation in blood urea nitrogen. A key correct action: administered isotonic intravenous fluids to restore circulating volume. The rationale: dehydration decreases renal perfusion, activating the Renin Angiotensin Aldosterone System. Although this compensatory mechanism raises vascular tone and retains sodium in water, it cannot fully correct severe volume depletion. Fluid replacement directly addresses the underlying pathophysiology and improves perfusion. Deepen your scientific foundation and strengthen exam readiness through clear explanations, practice questions, and case-based learning at NurseLearn Co. NurseLearn accepts Afterpay to support your success. Please make sure to like, follow, and share NurseLearn. NurseLearn was created by nurses for nurses, and we want to see you succeed.